Medical masks can help those who contact with patients. In pharmacies, masks become a deficit and somewhere they are not sold at all without a doctor's appointment. In conclusion, medical masks need to do by yourself. Today we'll know how to make a mask from available materials without special skills and equipment. There are a few ways to make a mask. They don't differ much in the sequence of actions, the only difference is the materials from which you will make it. First way, gauze mask. For manufacturing you will need gauze, needle and thread, scissors, ruler and rubbers. Cheesecloth fold in 4-6 layers. The size must be from 12 on 20 to 15 on 25 centimeters. Save everything in a circle, wrap the edges inside and the corners with a rollered bandage. For mounting on the ears you need to attach cord elastic bands. Gauze mask thin and not as effective as a bandage, but it is reusable. Second way, bandage mask. For manufacturing you will need bandage, ruler, scissors, needle and thread, rubbers and cotton. The size of bandage must be 12 on 20 to 15 on 25 centimeters. Bandage fold in 3-4 layers. Between bandages on this stage you can add cotton between layers. Cotton must be thickness on the 1 centimeter. The thickness may vary. Focus on the fact to make breathing easily for you. So we save everything together at the edges, save the rubbers or twisted bandages. That's it, the mask is ready. Disadvantages of bandage mask in that it's disposable but gives greater protection. There is also a paper towel mask, but we will not consider it because it doesn't protect you for anything and serves only for cosmetic purposes. Note that just cheesecloth masks you can wash, stroke and apply again, but bandage mask or gauze mask with cotton should be discarded after use. The maximum period of use of this mask is 2-3 hours, so it is better if you will prepare a few pieces for the day.